People with obesity get a lot of uninformed, unsolicited, and unhelpful advice. It comes from everyone, friends, relatives, even complete strangers they pass on the street. People who know next to nothing, or actually nothing, about you or your disease. Eat less, move more, they tell you. Watch your intake, hit the gym, cut the carbs. Everyone has gotten something they Googled, a proven method of dealing with what is a complex, highly individual, chronic condition. Obesity was first recognized by the American Medical Association as a chronic disease in 2013, which is the same year I passed my obesity medicine board exam. What the chronic in chronic disease means is that this is the disease people need to learn to manage for their whole lives. In that way, it's no different from high blood pressure, diabetes, or heart disease. What sets obesity apart from these other chronic conditions is the fact that it's so visible, which brings with it social stigma and bias. Imagine a world where that was true of every chronic condition. You would pass someone with hypertension, their blood pressure blinking on their forehead like a neon sign. People would stop them and say, "Chill out, dude. You should try yoga." It doesn't work like that. Of course, you can't just tell by looking at someone if they have high blood pressure or heart disease. But that is the world that people with obesity live in. And this makes daily interaction exhausting and demoralizing, as those with obesity regularly face stigma, stereotypes, and the widespread misconception that their condition is simply a matter of weak willpower or poor lifestyle choices. It's not that everyone can see their disease, it's that they think they know how to cure it. Despite the recognition of obesity as a chronic disease, the healthcare system has not evolved in its implementation of this knowledge. And make no mistake, the situation is serious. Obesity affects 140 million, or 42% of the US population, and 770 million globally. It is 4 times more common than type 2 diabetes and has nearly tripled since 1975. Shockingly, of those eligible for anti-obesity medications, only 2% have been prescribed these treatments. At present, obesity accounts for approximately $172 billion in annual healthcare costs, and there's more than 70 obesity-related medical conditions. Many of these are among the leading causes of preventable and premature deaths in the US. Those are a lot of numbers, so let me sum it up. Obesity affects more people than ever before. It is also treatable and preventable. Let me say that again. Obesity can be managed and lives can be saved, but at present, we're neither preventing it nor treating it as effectively as we could. We need to stop viewing obesity as a result of personal failings and start recognizing it as a chronic disease that requires comprehensive treatment. We need to approach obesity the way we do other chronic diseases, offering people the tools, support, and medical interventions they need to manage it, while also confronting the bias that exists towards people with obesity in ourselves and others. The key to this is changing how we think about this disease. My own journey into obesity medicine was deeply intertwined with my family history. My mother, Lali, had obesity, and her attempt to manage it was both highly visible and deeply misunderstood, both by herself and her doctors. She got a great deal of advice, tried many things, lost weight multiple times, only to regain it, caught in the same demoralizing and dangerous cycle that many face. Her final years, when she finally received the treatment she needed, were marked by significant weight loss and real improvements in her health. She became more active and enjoyed precious moments with her grandchildren. She passed away from complications related to obesity. She got help, and it was enough to change her life, but not to save it. Her story is not unique. People with obesity carry a burden of shame, don't talk about their condition, much less seek medical advice, or even know that there's ways to manage this disease. They lose hope. This is because they've been failed by a medical system and a society that refuses to acknowledge their struggles as real. We need to stop thinking of obesity as a personal failure and start understanding it as a chronic condition, as a forever problem. I know that's hard to hear, but it is true. But just as important is the understanding that we have ways to manage this disease effectively. There is hope. That hope is a new medical specialty called obesity medicine. So what is obesity medicine? And no, it's not just about moving more. No matter how many people tell you to hit the gym, exercise alone is not the cure for obesity. I know, that's great news, right? Exercise is part of the solution, but not the whole of it. Neither is cutting carbs. I know, more good news. Lack of exercise and poor nutrition can be both risk factors and results of the disease. But genetic factors, hormonal imbalances, and metabolic factors can also lead to obesity despite a healthy lifestyle. When a patient has obesity, the question of what comes first, the lifestyle or the disease, becomes irrelevant. We need to stop assigning blame and instead help people overcome the barriers they face. Obesity medicine stands on 4 pillars. The first is nutrition. That is the cornerstone. But it's not just about eating less. Diet decisions must be tailored to each individual and be informed, taking into account individual metabolism and lifestyle. About 80% of my patients have some form of insulin resistance, which makes managing carbohydrate intake crucial. But it's a complicated subject. Even eating a healthy meal can lead to weight gain if it doesn't align with one's metabolic needs. The second pillar is behavior modification, changing mindsets and setting realistic expectations. It's not about denying yourself certain foods, which is a dieter's mentality. It's about choosing to eat a certain way for the benefit it offers your body. This lifestyle mindset will empower you as compared to a dieter's mentality that is not sustainable and leads to diet fatigue. There's many substances that people need to be careful about when and how they consume them. Alcohol is a good example, as it stimulates appetite and changes our behaviors around food. Sugar can be addictive for many people sensitive to its effect on the brain rewards pathway. What makes food different is that we need it to survive. We need to eat. You can go cold turkey on smoking, but not on eating. People with obesity need support in changing their eating habits, as well as reliable information in order to pivot and use new tools for successful weight management. The third pillar is exercise, not as a direct tool for weight loss, but as a means of protecting muscle mass, regulating emotions, and managing stress. Lastly, medications. If it's prescribed, it's important to consider. There is no silver bullet, but medication levels the playing field, especially when lifestyle changes alone are insufficient. The role of medication is not as a cure-all, but rather to help you overcome the physiologic and behavioral barriers. The treatment of obesity, like that of heart disease and high cholesterol, often requires a combination of lifestyle modification and medication. It's about understanding and addressing the disease holistically. As an obesity medicine specialist, I empathize greatly with my patients. I see the biases and challenges they face, not just from society, but from the medical community and even from themselves. Obesity medicine remains a field often overlooked and underappreciated, but it is the key to providing comprehensive, compassionate care that utilizes all tools available. I want to leave you with two images today. The first is of a woman in her late 60s who for decades struggled with obesity, getting sicker and sicker until she wasn't able to walk more than 20 feet without shortness of breath, carting around oxygen tanks wherever she went. Imagine how much this limited her lifestyle. The second image is of the very same woman having found the treatment she needed for obesity, playing with her grandchildren, doing things she hasn't been able to do in years, living her best life. And that is the power of obesity medicine. It's not just a medical specialty, it's a beacon of hope for those who have been marginalized and misunderstood for far too long. I say this as a doctor who treats obesity day in and day out. Obesity is a forever problem, but it can be managed. It doesn't have to control or end your life. Thank you.